The most important decision in modern restorative dentistry is no longer just about how your teeth look, it is about what they are made of. As we move through 2026, a massive biological debate is dividing the world of oral surgery. Is it safe to have metal permanently integrated into your jawbone, or is the transition to ceramic the only way to ensure long-term systemic health? Today on Dental Vision 3D, we are conducting a definitive deep dive into the titanium versus zirconia war. We are using high-fidelity medical animation to reveal the microscopic reality of osseointegration, immunological responses, and the structural integrity of the two most powerful materials in dental history. If you are considering a dental implant, the information in this video could prevent years of inflammatory complications and aesthetic failure. Titanium has been the undisputed gold standard of implant dentistry for over 40 years. This specialized metal, specifically grade 4 or grade 5 titanium alloy, possesses a unique property called osseointegration. When a titanium post is surgically inserted into the alveolar bone, the bone cells actually attach themselves directly to the metal surface, creating a structural bond that is nearly impossible to break. This is why titanium implants have a historical success rate of over 95%. They are incredibly durable, capable of withstanding the massive biting forces of the human jaw, and they are resistant to fracture. However, as our understanding of immunology evolves in 2026, we are beginning to look closer at the potential downsides of metal in the oral cavity. One of the primary concerns with titanium is the potential for metal hypersensitivity. While rare, a small percentage of the population exhibits an immunological reaction to titanium particles. Through 3D visualization, we can see how microscopic metal ions can sometimes migrate into the surrounding soft tissue, potentially triggering a chronic inflammatory response known as peri-implantitis. Furthermore, there is the aesthetic challenge. Because titanium is dark gray, patients with thin gum biotypes may notice a gray shadow at the gum line, which can compromise the natural appearance of a high-end smile restoration. There's also the theoretical concern of galvanic corrosion, where the presence of different metals in the mouth, such as gold crowns or silver fillings, creates a small electrical current that can accelerate metal degradation. This brings us to the challenger, zirconia. Often marketed as the metal-free alternative, zirconia is technically zirconium dioxide, a ceramic material that combines the strength of metal with the biocompatibility of glass. In 2026, zirconia has seen a massive surge in popularity among patients focused on holistic health and biohacking. The primary advantage of zirconia is its absolute biocompatibility. It is chemically inert, meaning it does not react with the body's immune system and does not release ions into the bloodstream. From an aesthetic standpoint, zirconia is a game changer. Because the material is naturally white and opaque, it mimics the look of a natural tooth root, ensuring that even if gum recession occurs over time, there will never be a visible gray line. Before we analyze the technical differences in load-bearing capacity and the long-term fracture rates of these two materials, please subscribe to Dental Vision 3D. Our mission is to provide the world's most detailed 3D medical animations to help you navigate the complex world of modern healthcare. If you have a personal history with dental implants, or if you are currently struggling to choose between metal and ceramic, please leave a comment below and share your experience with our community. Your experience helps others make informed decisions about their own oral health. Also, be sure to send this video to a friend or family member who is planning a dental reconstruction. This material is essential for anyone looking to invest in a permanent smile. When we look at the mechanical engineering of these implants, the debate becomes even more nuanced. Titanium implants are usually two-piece systems, consisting of the implant body and a separate abutment connected by a small screw. This design allows for more flexibility in the angle and placement of the final crown. Zirconia implants, however, are often manufactured as a single one-piece unit. While this eliminates the microscopic gap where bacteria can congregate, reducing the risk of infection, it also means the surgeon has less room for error during placement. If a one-piece zirconia implant is placed at a slightly wrong angle, it is much harder to correct during the prosthetic phase. Another critical factor is plaque accumulation. Advanced 3D imaging shows that zirconia has a lower affinity for bacterial plaque than titanium. This means that the soft tissue around a ceramic implant tends to stay healthier and less inflamed, which is a major win for patients prone to gum disease. However, we must address the fracture factor. While zirconia is incredibly hard, it is more brittle than titanium. In the early days of ceramic implants, fractures were a significant concern. In 2026, material science has improved zirconia's toughness significantly, but titanium still holds a slight edge in terms of shear elasticity and long-term mechanical resilience under extreme pressure. Cost is the final and often most significant barrier for many patients in the USA and Canada. Zirconia implants are more expensive to manufacture and require a higher level of surgical expertise to place, often resulting in a total cost that is 20 to 30% higher than traditional titanium. Patients must weigh the aesthetic and holistic benefits of a metal-free existence against the proven 40-year track record and lower price point of titanium. The verdict for 2026 is that there is no one-size-fits-all answer. If you have a known metal allergy or a thin gum biotype, zirconia is likely the superior clinical choice. If you require a complex full mouth reconstruction where maximum structural strength and prosthetic flexibility are needed, titanium remains the industry standard. The future of implantology lies in the personalization of care, choosing the material that aligns with your specific biological profile and aesthetic goals. By understanding the 3D science behind these materials, you are no longer just a patient, you are an informed advocate for your own health. Thank you for watching Medical Vision 3D, and stay tuned as we continue to explore the frontiers of dental innovation.